Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and we are streaming live from the Moses Lake Professional Pharmacy Studio on a Tuesday today, our midweek podcast. And we have the pleasure of having Chris Habig from Freedom Healthworks back on our show. We kind of have him on a three-part series. Today, we're going to be discussing the importance of the doctor-patient relationship. It's something that's frequently forgot about. Over the last 10, 15 years, it seems like there's really not a good doctor-patient relationship, partly because doctors don't stay in the same place very long. I had a good friend say one time when his doctor had moved for the fifth time in 6 years, that they're like gypsies, and that used to not be the case. It used to be that 30, 40 years ago, people would have the same doctor for 20, 30 years, and Chris can speak on that. And that's still very important to have that important relationship, not just a 5-minute conversation, but somebody that knows you as an individual and knows your family. Very, very important. So without further ado, Chris, welcome back to our show.
Thank you, Shawn. Pleasure to be back again. I'm amazed that you asked me to come back on after that first episode.
Oh, it was wonderful as always. We could just keep talking and talking and talking. You made a joke before the show when we were just talking. You said you should have hit record 20 minutes ago because we had some good conversation, as we always do, Chris. So it is definitely my pleasure. Thank you for coming back on.
Yeah, absolutely, absolutely.
So tell us a little bit about. I think sometimes maybe it should be kind of obvious how important the doctor-patient relationship is. But unfortunately, over the last 20 years or so, I think people have forgotten about it because they haven't seen that really in traditional healthcare. So tell us a little bit about this.
It's going back to defining what the pinnacle of medical care really is. And I say medical care, obviously, because I think healthcare in general has been perverted as a term and a definition, and people attach insurance to healthcare. So I'm talking about medical care. You ask somebody, hey, what is the real high quality? What is the best medical care that you could possibly strive for? And you can get a bunch of different answers. To me, the best medical care is when you have a physician has the ability to look at you and know that something is a little bit off. We can sense this in our daily relationships. We look at our spouse, our friends, and we say, hey, look, you look a little down. What's wrong? What's on your mind?
Right.
To have a physician who's able to do that, I mean, that's potentially life-saving. That's the seriously life or death type of relationship and type of situation you can find yourself in. I believe I related, this personal story about when my grandmother was ill because she took too many blood thinners, in her late 80s, early 90s, and her internist, which was my mom, was able to look at her and say, hey, you don't look great. You look really pale. Why don't you come in? Found out that internal hemorrhaging. I mean, that kind of stuff those are serious real life stories.
Right.
We talk about population health. I get population health as a society. And those are some, that macro environment has a lot of uses. But when it comes down to individual people, there's a good chance that you get lost in the shuffle. It's you don't want to be that person that has the 1 or 2% chance of having early onset colon cancer, or if you're a guy in your 20s, you don't want that small minutia chance of having testicular cancer that goes undetected. Those are real life. Those are real lives there and real impacts. Maybe you're a car company, you can get away with 1% defects, but when it comes to human beings and lives, it's unacceptable in my book. And so it's a shift in mindset from focusing on a macro, focusing on the trends, and getting down into the micro environments, and a physician able to understand your habits, your history. Maybe this doctor even took care of your parents. Maybe this doctor delivered you and you're seeing them as an adult, and they're going to see your kids now.
Yeah.
But to understand that, okay, maybe breast cancer runs in your family. We're going to keep an eye out for that. That is the pinnacle of medical care, in my opinion.
Yeah, I interviewed a direct primary care doctor, also known as DPC, and of course, Chris, you've talked a lot about that on your podcast, Freedom Healthworks, and one of the stories he shares is he, family doctor, and he had, this mom came in and she had 3 or 4 or 5 kids and brought them all in. And one of the kids was sick and, just runny nose, whatever, common cold type stuff. She's brought him in, and he looked at one of the other kids and he says, you know what? I don't want to see this one, even though he's sick. I want to see your other kid because he didn't look right. And I can't remember the disease that he diagnosed him with, but it was some rare, disease that if not caught early, could be deadly. And I like I said, I
Wow.
don't even remember the name, but there's no way in a traditional healthcare setting where a doctor doesn't know their patients and doesn't know the family. There's no way that would happen. And he was able, and because he wasn't limited by insurance and all those kind of things, he could say, hey, I want to see that kid now, because of the nature of a DPC practice. And I mean,
Mhm.
if you want to speak on that, I would sure love that. And so would our listeners and viewers.
Yeah, it goes to, I mean, how many offices out there are saying, hey, only one patient at a time? I
Yep.
mean, understand we're in the midst of a prolonged pandemic, and think of it what you will. And unfortunately, politics has been injected into every aspect of our lives. But, being able to take your kids and round them up and take them into a physician and have that, it's huge. I mean, we're seeing, coming from a dad of now 2 young kids, RSV is making a huge comeback in daycares. And so for our direct care doctor to say, hey, I understand that your daughter is in daycare, keep an eye out for these traits, for these symptoms, for disease, and then be able to treat everybody right there. I mean, that's powerful. It just illustrates the point that sight is by far and away the most important sense to a human being. And I don't think a lot of people are going to debate that. It might not be our favorite,
Yeah.
or most
Yeah.
useful as I'm sitting here in my glasses. But, being able to have that and have that just, I don't know, awareness, in connection with somebody. I mean, that's usually powerful, because what usually get lost in that is saying, yeah, we treated this kid, but imagine the impact on that parent. And I can speak from experience on that half the battle is peace of mind. Is this rash something I need to worry about?
Right.
How do I do this? Is this cough going to go away on its own? How long does a first, cold last? What do I need to look for, like I mentioned, RSV, and I've had a lot of, personal family friends who've been impacted by RSV, and some kids who just weren't exposed to others, from a society standpoint and from a social standpoint. But there's really stuff going on that we get lost in the headlines. And being able to text your doctor, being able to bring the whole family in, I mean, it's powerful in itself. Not to mention a huge cost saving. But think of the peace of mind and the stress that was avoided, that would have happened at a later stage.
Yeah. And, we talk about like those days are gone. And I think with traditional medical care, like we talked about, insurance-based practices, those days are gone. It's one patient at a time. And also, uh, I don't know if a lot of people realize this, but many times those doctors are also told, oh no, you can only come in for 1 or 2 problems. That's it.
Mhm.
If you have a second problem or a third problem, you need to make another appointment. And how ridiculous is that? I mean, that is, in my opinion, not good medical care.
Oh, for
Um,
sure, for
yeah.
sure. And like you said, vast majority of physicians do not want to practice that way. It's kind of the fallacy of this free preventive visit that a lot of people talk about when they say, "Hey, I got great insurance, Shawn. I got great insurance."
Yeah.
What does that mean? Who's your
Right.
doctor? Who are you going to call when you're sick? And I say, well, I
I
guess
don't
that's a
really
good question.
right. Yeah.
I'll get seen in
Um,
3 weeks, right?
as the saying goes, it's definitely not original from me. I think it's Dr. Marion Moss that said, coverage does not equal care.
Mhm.
So just because you have some kind of insurance coverage doesn't mean you're going to get good care. And just the opposite is true. Just because you don't have insurance doesn't mean you can't have a good relationship with a doctor and not get good care. I know many of people in that situation because healthcare can, be affordable.
Hmm. Yeah, and it brings up this topic that that I don't think we spend enough time really talking about. A lot of people want to say, how can I change healthcare? What can I do from my end? I'm just a person. I'm just an accountant, whatever it is. And I always tell them, well, go ask the price, because if a doctor can't tell you the price, then chances are somebody else is going to have to come into that decision. And if a doctor can't tell you the price of their services, there's probably be somebody else involved in your care decisions too. And that can be a very big problem for a lot of people. And I see that as a problem. I don't want that, to happen. And that kind of gave way into, I think, the overarching question that is plaguing a lot of our healthcare industry is this concept of patient ownership. And we talked to one of I had a great interview with one of my clients at Freedom Healthworks, and he brought this up as his big kind of watershed moment, that when he had an administrator at a hospital berate him for referring a patient to a different hospital that could actually treat this patient in a better way because their facility wasn't set up to do that. Wow. That administrator flat out told him, "Doctor, you don't make those care decisions. This is not your patient. This is ours." And that blew me away.
Wow.
This concept of owning a patient is something that I think needs to be illuminated. And, it falls very much within that doctor-patient relationship. I see my doctor. I don't go see the hospital, right? The hospital is not involved in patient care. It's involved in the business of providing care, but is not involved in actual medical care.
Well, and it gets back to, the old thing that, physicians need to be in charge of medical care, period. And, not too long ago, that was the case. That hospital administrator 30 years ago, that doctor would have told that hospital administrator what to do and when to do it. And a hospital administrator would have said, well, you're the doctor. We can't survive without you. And it's not that way anymore. Now the administrators are telling doctors what to do. I mean, we're talking about people that aren't educated, aren't formally educated in medicine, that are telling doctors how to practice. You agree with that?
Absolutely. Absolutely. And it's just a symptom of the overall, just, I don't want to be too negative, but the overall kind of rot and control that a lot of systems have. It started about 10 years ago, and the whole thinking coming from, what I call health insurance reform, that the federal government branded healthcare reform in the ACA. They thought that if we consolidate resources and create these big bureaucratic hospital systems and healthcare systems, that's going to drive efficiencies and cost. Now, I'm a big fan of separating price and cost, especially as it relates to medical care, medical services. But that's what the whole hypothesis of the ACA was built on. I think there's a lot of people out there that could put, again, politics aside and say that was a huge miss. Anybody who is familiar with large companies understand that innovation is very, very slow. There's a lot of layers. There's a lot of hoops you have to, and gates that you have to jump through, and a lot of signatures you have to get to try something new. Innovation comes from small businesses. Draw a parallel to medical care. A single physician office is able to incorporate innovative treatment techniques and personalized care far better than any 10,000 patient hospital system is able to do, 20,000 hospital patient. And that was the big miss there. And so what we really drilled down to is that this concept of doctor-patient relationship, that really funds 1/5 of the United States economy. It is a multi-trillion-dollar relationship. Again, you got people sniping saying, look, there's a lot of waste there. It doesn't have to be trillion, but 1/5 of our economy is healthcare. And that is fundamentally built on the interaction between one patient and one doctor.
We've talked about it before on our podcast, is that, many times the bigger the system, the more expensive. I mean, you kind of alluded to that, but the bigger the healthcare system, the more expensive it is, the less efficient, the less quality, and the worse service. And, you could also argue that sometimes in healthcare, many times in healthcare, that price is inversely proportional with quality. The lower the price in healthcare, probably the higher the quality.
What does quality actually mean to that though? Quality to me, understanding and living within, subscription-based healthcare for the past few years, that means something totally different. To me, quality is keeping me healthy,
Yeah.
educating me enough to have some personal responsibility in there, but being there if I get sick, being there if my family gets sick. I think I'm kind of on the minority of that. Most people would say, "Hey, what's quality healthcare?" Especially people in medicine. I've talked to a bunch of CMOs here, around Indianapolis and regionally, and I say, "Doc, what does quality mean to you?" And no joke, I've had a bunch of them look me in the eye, kind of chuckle, kind of laugh, and say, "It's whatever Medicare tells us it is. It's whatever United tells us it is."
Right.
And I'm kind of blown away. Like, again, that's the last thing I want to hear from a patient standpoint. Say you're somebody who's in a hospital bed and the doctor comes in and says, "Hey, we're going to provide really high quality care to you. This is what we're going to do." And I say, "Great, but why are you doing this? Why do I have to have these tests or these images?" And that doctor, being honest to him, would respond, "Well, that's how we get paid more, because the insurance attaches more value to this." I think about that from a bedside standpoint. What would somebody
Right.
actually do? What would your reaction be if you're a patient? Another famous, not famous, I guess it's one of my better used stories is, I talked to this physician who ran a teaching hospital primary care department, and so she was making rounds with the residents, and she had residents who were getting in trouble from the admin because they were taking too long with patients. And I'm just going to let that
Yeah.
sink in. And again, think about that from a patient experience standpoint. That imagine having that conversation in somebody's bedside. Is, "Hey doctor, I know that grandma over here is really sick and needs comfort, but you're taking too long with her. You need to go move on." It just blows my mind that people treat other people that way. There's a lot of issues to point out in how big healthcare is run, and one of the things I like to do is establish the problem, but move on to solutions. Let people know that, hey, there is hope out there.
So
It's
let's
happening.
talk about the solution. So what, from a patient standpoint, what's a solution?
Every patient should go in there knowing the price, knowing what needs to happen, and you have to ask questions. One of the most dangerous things that anybody can ever have is happen to them is being alone in the current healthcare industry. If you're alone, you see patient abandonment. You kind of see this lost sheep syndrome, I like to call it, that people just kind of blindly go about things and don't ask questions of, well, why are you prescribing this? Why do I need this procedure? How much does this cost? We place an inordinate amount of trust in our physician without probably knowing who the hell that person is.
Yeah.
We might see somebody for 5-7 minutes and they say, "Hey, great to meet you. I'm Dr. So-and-so. Looking at your chart, here's what I think it needs to happen. So I'm going to send you down the hall and you're going to get all these scans and everything." And that's it. And we say, "Okay, great. That sounds nice." Why would you do that without saying, "Well, hold on. Who are you?
Right.
What do you know about my medical history? What do you know about my family?" You're not even going to ask me a question, but all this happens all too often. Again, I think people are very quick to blame the quote unquote system and not confident enough, or they don't want to upset anybody by actually blaming the physicians. And I put a lot of blame at doctors. One, for letting this happen to them, because I can't imagine that in any other, kind of profession. People just getting so beaten over the head and downtrodden that they kind of give that up and don't want to ask about any financial decisions that have to happen from a patient care standpoint. And so, from a patient standpoint, you have to be empowered. You have to do your research. You have to understand that there is no such good thing as insurance. That's like going out and saying, "Hey, I got the best homeowners insurance on the block." Well, you still need to fix your leaky toilet. You're not going to file your insurance claim for that, right? You still need to do your maintenance on it.
Right.
It's just a mind shift. And A lot of people like to bring up the matrix, and we've heard it time and time again in some of the circles that we run in, but it really is that kind of psychological switch that has to, go on to realize that, oh my gosh, it's okay to go out and call a doctor at the first symptom. I'm not bugging them, but with that same vein is you need to have the access to establish that relationship. And from that relationship, that doctor can now become your advocate. And that's really what we want to get to, going back to how we opened the show, is that's the pinnacle of medical care. When a doctor is able to understand your needs and you're able to really ask them that question. So that's my plea to every single patient out there who's ever ever been sick, is step one, how you enact change is go out there and ask somebody what the price is. Ask your doctor what the price is. Ask the front office person what the price is.
And if they don't know,
if you don't know, make sure they get an answer or get the hell out of there.
Yeah.
You have the ability to walk.
You wouldn't buy a car without knowing the price. You wouldn't rent a hotel room without knowing the cost. So why should you get medical care, which is way more important than those two items?
Right. And the only thing that keeps coming back to is, well, I waited 3 weeks for this appointment. I'm not going to walk out. And it's like, okay, well, there goes all your leverage from a consumer standpoint, negotiation standpoint, but that's not the point. The point is that if somebody can't tell you what the services actually cost, even if you walk in the exam room and they say, well, it depends on what you want to do. Go back to the fallacy of the free preventive visit. If you mention anything in there about, hey, my elbow hurts, or I'm having a little bit of chest pain, or I get short-winded going upstairs, that's no longer free. You're going to get a bill. And so, it's trying to break down the complexity of the billing systems, and then, the services and the cost and the price. Basic economics is alive and well in medicine. I want to say that.
Absolutely. Consumers just need to be educated and empowered to shop for healthcare.
Exactly. On most industries, you've got a manufacturer, you've got a distributor, you've got a wholesaler, and then you have retail. Maybe you go through 4 chains to pick up a new desk or chair, something like that. With healthcare, it's probably double that. But it does not mean that you are absolutely powerless. You have all the power. You just need to use it.
Right. Now, speaking of solutions, so you kind of blame doctors a little bit. And, at first when I started getting into this discussion and started writing a book about this subject, I was kind of, being careful about blaming my colleagues or blaming doctors. Because I just always says, well, I get it. They don't have any power over it. They're just stuck in a system. They don't really have any control over it. But then I had an interview with the great Dr. Keith Smith, probably, from the Surgery Center of Oklahoma, probably one of the biggest pioneers in free market medicine, who opened a freestanding surgery center back in 1997 when people thought they were crazy to get out of Medicare and Medicaid and all the insurance hassles. And Dr. Keith Smith said this, and this is a quote in my book. He said, when he was in the system, he basically felt like an accessory to the crime. Mm-hmm. And I got to say, Chris, I do believe that. And I'm not picking on my colleagues or whether it be pharmacists or nurses or doctors. But if you are in the system, especially as a doctor, when you were writing a prescription for an MRI or for XYZ drug or for XYZ surgery at XYZ hospital, you are an accessory to the crime. And the only way to fix that is doctors need to be in charge of the system and where patients go. Can you comment on that?
Everybody has a choice. Everybody has a choice. Whether you're a physician in a hospital, you are a resident coming out with loads of debt, everybody has a choice. What you might not be aware of is what choice you have. And I think that is probably, the biggest problem. A lot of doctors come from teaching hospitals, obviously during residencies, and those teaching hospitals want to keep that physician there. They're not going to go out and show, hey, look, independent practice is alive and well. They're not going to tell you that. They're going to tell you different models of care, different business models. They're not going to even give you a business education, but that's a choice. There are resources out there. Freedom Healthworks being one, shameless plug right there. But even if it's not a good fit, we'll let you know that, hey, look, there's options out here. You have a choice. If you choose to go work in a hospital that does not have your patient's best interest in mind, okay, I respect your decision. But be able to accept the responsibility for that decision. And if your medical decisions are, in your mind, the best way to treat this patient, but you're also bankrupting that patient, then you're accountable for that. And you should understand that. That's where I think there's a big disconnect between what we see in the actual medical professionals who are drawn to this because they actually want to help people. These are the smartest, most salt of the earth people, right?
Right.
They're so intelligent that not everybody could do this, and very few people could actually do this career. And they are so just they have the ability to go out and put themselves in other people's shoes. The empathy is unreal, and they actually want to care for these people. Not everybody can do that either, from just the human nature side of it. So you have two people, or you have a person that has these traits of incredible intelligence, incredible motivation, incredible drive, that also want to go out there and help their fellow human being. You telling me that they can't go out and research different types of business models and understand that, hey, you're going to be complicit in either a system that is a problem and not in the best interest of those people you're trying to care for. It just seems lazy to me. And that's something that I kind of scratch my head with, is like, these are not lazy people at all, but yet they act like an ostrich with their head in the sand when it comes to anything financial.
And do you think that comes from academia? When they're being, yeah. And do you think it's a little bit fear too, because it's not, they might be going out of the system that's traditional?
I think yes. I think it's not a quick. It's not an immediate thing that happens. I think it's more attrition than anything. Kind of like World War I trench warfare. It's last man standing kind of the mentality, and I think it does start in medical schools. Vast majority, there's a great story that I got related to. I'm all about stories, Shawn.
I love it.
Vanderbilt University. I was talking to this young doctor about, she was a resident and she was inquiring about, hey, direct care is something I learned about in medical school, but residency, or actually it was even before medical school. Excuse me. So back up even further. She goes, I got to medical school at Vanderbilt University, prestigious university, incredibly difficult to get to. She said, I let them know that I desire to be a primary care doctor. And she goes, the faculty there laughed at me. They said, Vanderbilt University does not produce primary care physicians. And I'm thinking, oh my God, that's the start of it, right?
Yeah.
And I really that's the start of it.
Like it's beneath them or something.
It is. Yeah. Yeah, absolutely. It just blew my mind. And so here you take somebody who's incredibly intelligent, who has the empathy for a fellow human being, but yet is already getting her wrist slapped and starting to get more downtrodden, more negativity at her, saying, oh no, your dreams of practicing medicine the way you wanted to, nope, we're not going to even entertain them. And so you could see how this snowball effect starts in the medical school, because boom, there you go. I have this vision, and then now all of a sudden, boom, they're not going to even entertain it, and they're going to steer me into this, specialties and subspecialties and surgeries, which we need good people there too. But going from a mental standpoint, impact, that's the start of it. And so you continue that and saying, well, I really want to care for people this way. Nope, not going to happen. Okay, why? Doesn't matter why. You're not going to do it. Right? Well, what about independent medicine? Nope, independent medicine's dead. The only choice you have is to sign on this dotted line. Well, why would I want to do that? Well, here's a bunch of money. Oh, okay. You get your debt forgiven. And so I hope I'm painting this picture of step 1, step 2, step 5 of how we get there and how many steps it is. But you push that snowball down the hill, and now someone comes out the other side of residency and they're already mentally abused
Yeah.
from academia, and not to even mention the continued abuse from an employer that will happen. And then they're going to try to tell them that they're just burnt out and they need to go do more yoga.
I think one of the reasons that medical school is so expensive is, well, it's partly due to the healthcare. It's partly like health insurance. When somebody else pays the bill, it gets more expensive. Now,
Mhm.
you always got to pay the piper. There's no doubt about that. But a lot of times there's these federal programs. Maybe they're loan programs. So at first they're not paying anything up front, but in the end they get out of school, and I hear a new number every year. It's a new record number. My first, I almost fainted when I first heard $400,000 in debt, and then I heard 500. Then I heard 600. Now I've heard 850.
Wow.
That was on a Facebook group, not somebody I knew personally. But and then they go to, so they're in huge debt, and even if they're making decent money, I mean, if you go out and you have a house payment for 40 years or 30 years, I mean that's slavery. You could argue that's slavery.
Hmm.
And so they go to these institutions that pay big bucks, partly because these institutions are given federal grants to serve underserved areas and all this kind of stuff, and they use this money to recruit physicians and pay them big bucks. And if you work for them for 2 years, you get your debt forgiven. And here's what I've seen in that. Okay, the federal government is guilty of giving these loans to people, and then they essentially give them a placement in a federal government institution. It might not be directly federal government, but there's funds tied to that. And then they indoctrinate the people on the way to take care of those people in that federal clinic, and then they have them for life. Can you comment on that?
It's kind of like, we always say the biggest threat to our industry and our business and what we're doing from a grassroots movement is if the federal government said, hey, we're taking medical licensing away from states. And in order to be a doctor, you have to have a United States medical license, not an Indiana license, not an Oregon license, not a Texas license. You have to have a United States. And in order to get a United States license, you have to accept federal programs.
Yep.
This, this seems like a way to influence that, where people aren't really paying attention to it. And you drive up the cost of medical school, but you say, hey, you might be, for round numbers, let's say, you're $500,000 in debt, but you go work at this FQHC, the Federal Qualified Health Center.
Yep.
In those, I've seen some weird kind of location dynamics where, these FQHCs are in places you're like, this is strange. This feels
downtown
more
Seattle, underserved downtown Seattle, really? Okay.
Yeah.
Right.
It feels more like political favors, right? And establishing these things.
Yeah.
So, the medical school is $500K, but if you go work for FQHC or even a nonprofit hospital, which I think is one of the biggest enemies to price stability in healthcare that we've come up with, then, $100,000, $200,000 is forgiven. Well, wait a minute. So what's the true cost of actually providing an education to physicians? And why are you incentivizing, you're really incenting more public dollars to be spent by actually crippling private industry? And so what you see is tax exempt organizations or federal organizations picking winners and losers. And I got a big problem with that.
Yeah, absolutely. Yeah, that's exactly what it is. And anytime that happens, prices go up, service goes down, quality goes down. It just look at history.
You're influencing markets in a way that is, non-competitive. It's artificial influence. And when that happens, the people that lose when artificial influences hit markets, it's the people at the bottom. It's the consumers. Yeah. Absolutely. Yeah. We see that from wage hikes. Those get passed on. We see that from taxes, and anybody with a shred of economic knowledge knows their supply and demand curves and understands the impact that taxes and artificial mandates and artificial caps have on that. And ultimately, those things get passed down to people like you and I, and we're always the ones that are powerless to do anything about it. But physicians get used in this sense. They get used as the intermediaries. So now you have people who are pissed off at greedy physicians, and then you have hospitals who are blaming doctors for not following orders. And it's a tug of war. And so I'm quick to blame a doctor for not knowing the price of a service, but I'm also very quick to show that, hey, you are getting toyed around with, and you are just a puppet here. There's a better way of doing things.
Absolutely. So, are you optimistic? Are you optimistic that there can be a change? Can we affect change?
Absolutely, we're doing it. We're doing it, Shawn. I mean, we've built out a completely cash pay medical system that we are putting patients through. A primary care, a primary Freedom doc calls us up, says, "Hey, I need somebody that I need a cash price for oncology. I need a cash price for surgery. Do you have options?" We say, "Heck yes, we have options." And it's almost like a burgeoning domestic medical tourism industry, but we're able to link them with other cash pay, self pay, however you want to call it, direct pay physicians who are able to give them a price right away, even if it's just a consultation. Hey, it's $150 for 30-minute oncology. Great. I understand that. I can budget for it. And then if we need to escalate things beyond that, great. I'm with you. I'm by your side the entire time. So these things are happening. This isn't just a dream. This isn't just smoke and mirrors. This is actually happening, and patients are flowing through the system. We need more doctors to raise their hand. Whether you work with Freedom Healthworks or not, that's fine, but we're all moving in the same direction. So let's remember that, and provide the actual level of care that doctors want to provide and are able to provide. Let's let them practice the way that they know how, and not influence it. And let's treat patients right. So it is happening. It's all just doom and gloom, downward spiral. Right. There are real success stories happening, and it's impacting real lives. It's just we need more people to know about it, and I don't think trust is the right word, but actually go through it, step through that door of saying, "Hey, I like what you're hearing. I like what I'm hearing. I like what you're saying. I'm going to give it a shot."
I love it, Chris. And yeah, I agree with you. And I will tell you, kind of being in the middle of this revolution, even though it's really not new, it's just over the last few years, there's been a bigger push to go to free market medicine. I will tell you, it's wonderful to be in the middle of it, because when I talk to when I talk to all physicians that are in the free market medicine, they're all happy, all of them.
Yeah,
and
nobody
I
wants
can
to go
say
back.
no, and I can say, and I'm guilty of that too. I mean, I've told people this in public, and I'll go on record saying this: you could not pay me enough. My wife and I will both say, you could not pay us enough to go back to a traditional insurance-based pharmacy. You could not. There's no way.
Look at what you guys are doing. You are taking healthcare and you are relocalizing it. And correct me if I'm wrong here, Shawn, but I don't think this is going on a limb. But the relationships that you're even able to establish, with your pharmacy patients, pharmacy customers, it's this reemergence of local healthcare. It's keeping dollars in the community too, and people overlook this. Some of the largest healthcare systems are multi-state organizations where you pay them, that money's gone. That's sucked out of the local economy. Those systems aren't paying taxes on their properties. Most of them nonprofits. They're contributing very little to the local economy. Yeah. They employ people, but property taxes going to school systems. There's a school of thought out there that a nonprofit hospital in your area, like in your town, in your city, is not good for the economic livelihood of your town or city, based on that nonprofit status. And so if we're able to say, look, I'm going to spend my money with the doctor who lives here, and then I'm going to go to my local pharmacy, like Moses Lake, right? And I'm going to keep my dollars there because I know those people are their neighbors. I see them at restaurants and soccer games. The relocalization of a healthcare dollar is something that can be a massive, massive driving force. And it shouldn't be something that is overlooked. but it very easily is. And the more attention we bring to that too, I think the better off we're going to be.
Well, and speaking of nonprofit hospitals, let's just call them what they are, Chris. They're tax exempt. They're not nonprofit.
Fair.
I had a former hospital administrator on our podcast a few weeks back, and he cleared that up.
Yeah.
And because, and I agree with you. We have a public hospital in our town, and I've been a publicly elected official commissioner on that board. And I will tell you, public, private, nonprofit, for-profit hospitals, they're pretty much all the same, and they are in collusion with insurance companies to rip off the individual patient in their local community. Period.
Mm-hmm. Mm-hmm.
It's a scam and a ripoff.
Well, that's why we let people know they have a choice. You just have to exercise that choice. Exercise your American right to choose.
That's right. That's right.
That's what it's all about. And so more people understand that, again, the better off we're going to be. And the more and more that this momentum we have that we see, more and more that continues to grow.
So Chris, tell us, as we wrap this up, tell us a little bit about Freedom Healthworks and how to find it.
Well, it's all about what we do is all about enabling patients and enabling physicians to practice the way medicine should be practiced, according to them. We have a great little a new brand, kind of, I would say, called Freedom Doc. And so what we say is Freedom Healthworks helps create Freedom Docs. And so patients can then go join their local Freedom Doc, in 20 some states that we're in right now. So freedomhealthworks.com for those medical professionals who are interested in finding out what their choices are and how to practice medicine. freedomhealthworks.com. Great resource for you. For any patients out there who are looking to join this movement and choose a better way to seek medical care, we have a new website called freedomdoc.care. And there you can see all kinds of resources and why you should be joining Freedom Doc practice, as well as resources for employers that are looking to provide better benefits and really redefine what it is to show employee appreciation and take care of your team and keep them as healthy as possible. So options for everybody. I hope people understand that I don't view anybody in direct care as competition. This is all some way that we can all help each other, because we all want what's best for the country, for patients, and for each other.
I will say that's one thing about direct care. There's a few big names out there. I guess they're all big names in my book, but where you can just give somebody, they could be a primary care doctor wanting to open up a clinic right across the street from this person, and you can give them that person's number, and then they're just like, hey, yeah, more the merrier. And I agree. There can't be enough of us. I think the more the merrier, because it's got to be a grassroots movement from the bottom up.
Yep. And we always say, look, if you want to follow the Freedom Healthworks playbook, let's do it. If you want to go out and do it yourself, go for it. Just be wary of people out there that say that, hey, it's either my way or the highway, or try to steer you to work with somebody and not somebody else. When somebody starts throwing stones, and that's the only time you need to be wary. Everybody else wants to work together.
Or when they want you to put a big chunk of change up front, and it's going to cost a bunch of money, because in reality, as you know, Chris, because you help doctors with this all the time, it doesn't cost a lot of money to go into independent practice by yourself. If you're primary care, it doesn't cost much at all.
And if you're smart about it,
right.
And that's one of the biggest pieces of value that we're able to bring is we're going to help you prevent mistakes, very expensive mistakes that could sink your practice. And I think that's one of the biggest challenges and biggest kind of the risks of doctors going out and getting advice online or from people who might have done it in a way that worked for them, which is great. But then if they take that advice, free advice is sometimes useful, but usually get what you pay for in life. And so if those physicians are unsuccessful and they go out and say, hey, I tried this and I tried to do it this way and the model just didn't work, it's not viable, that's going to have a ripple effect. And that's one thing we can't afford to do is lose anybody who started their practice. We can't afford any failures. And so right now we have 100% success rate. None of our clients have ever closed down, and we're going to keep it that way. Thank you, Shawn.
Thank you, Chris. And as always, it's been a pleasure. The viewers, listeners, thank you for tuning in today. We really appreciate it. Health Solutions with Shawn and Janet Needham. Thanks for listening.